Building sexual confidence and understanding your body. Sexual confidence is a crucial aspect of a fulfilling intimate life, yet it's often a challenging topic for many individuals, especially women. A significant part of building this confidence comes from understanding and being comfortable with one's own body. This educational discussion draws from the insights shared by sex educator Dr. Emily Morse, host of the podcast Sex with Emily, where she delves into the importance of self-awareness, body positivity, and effective communication in sexual relationships. Understanding your body, the first step to sexual confidence. One of the foundational steps towards conquering insecurities in the bedroom is developing a healthy relationship with your own body. This involves exploring and understanding your anatomy, which can empower you to take control of your sexual experiences. According to Dr. Emily Morse, self-exploration is not only about learning what feels good but also about understanding the unique characteristics of your body, including your vulva and clitoris. Self-exploration and pleasure. Dr. Morse emphasizes the importance of self-pleasure as a way to build sexual confidence. By taking the time to explore your body, you can identify what types of touch and stimulation bring you the most pleasure. This knowledge is invaluable when communicating with a partner about your needs and desires. Knowing how to pleasure yourself can remove the fear or discomfort associated with receiving oral sex or other forms of intimacy from a partner. Breaking down common myths. There are numerous myths and misconceptions surrounding women's bodies, many of which are perpetuated by societal pressures and unrealistic portrayals in media, such as pornography. Dr. Morse stresses that no two vulvas look the same, likening them to snowflakes in their diversity. This comparison helps to normalize the wide range of appearances and can reduce the anxiety that many women feel about their bodies not looking normal or perfect. Body positivity and acceptance. Body positivity involves embracing your body as it is, without succumbing to external pressures to conform to specific standards of beauty. Dr. Morse advocates for women to appreciate their body's uniqueness, which includes accepting the natural variations in vulva appearance, breast size, body shape, and more. This acceptance is crucial for building confidence in the bedroom and beyond. The role of partners in sexual confidence. Sexual confidence doesn't develop in isolation, it is also influenced by the attitudes and behaviors of your partner. Dr. Morse points out that being with a partner who is enthusiastic about giving you pleasure is essential. If your partner shows disinterest or reluctance in activities that are important to you, such as oral sex, it may be a sign to reconsider the compatibility of the relationship. Choosing the right partner. A partner's attitude towards your body and your sexual needs can significantly impact your self-esteem and confidence. Dr. Morse suggests that a good partner is one who respects and enjoys your body as much as you do. They should be willing to engage in sexual activities that bring you pleasure, and if they're not interested, it may be worth reflecting on whether this partner truly meets your needs. Communication is key. Open and honest communication with your partner is vital for a healthy sexual relationship. Expressing your desires, setting boundaries, and sharing what makes you comfortable can foster a more satisfying and respectful partnership. Dr. Morse recommends framing conversations in a way that invites collaboration, such as, "I'm exploring my own body and would love for us to explore together," rather than framing them as criticisms or demands. Debunking myths about men's preferences. A common misconception is that all men have a universal disinterest in performing oral sex on women. Dr. Morse dispels this myth by explaining that preferences vary widely among individuals, and there are many men who enjoy giving oral sex as much as they enjoy receiving it. The key is to be with a partner who shares your values and desires in the bedroom. Societal influences on sexual behavior. cultural narratives often shape how men and women view their roles in sexual relationships. Pornography, for example, frequently depicts unrealistic scenarios that can lead to misunderstandings about what is considered normal or desirable in bed. Dr. Morse encourages listeners to look beyond these portrayals and instead focus on what feels good for them personally. Embracing sexual diversity. Just as women's bodies are diverse, so are men's preferences. It's important to find a partner who is genuinely interested in your pleasure. If your partner is not willing to engage in activities that are important to you, such as oral sex, it could indicate a mismatch in sexual compatibility that should be addressed. Addressing infections and sexual health concerns. Sexual health is an integral part of sexual confidence. Dr. Morse discusses how certain infections, like yeast infections or urinary tract infections, UTIs, can occur more frequently with certain partners. These issues can sometimes be linked to a mismatch in pH balance between partners, hygiene practices, or the types of lubrication used. Maintaining vaginal health. Keeping the vaginal area healthy involves paying attention to factors such as pH balance, hygiene, and the frequency of sexual activity. Using the right type of lubrication can also help prevent infections by reducing friction and ensuring comfort during intercourse. Dr. Morse recommends choosing lubricants that are free of irritants and suited to your body's needs. Understanding your body's responses. It's important for women to recognize the signs of infections or imbalances and address them promptly. Common symptoms of infections include itching, unusual discharge, and discomfort. If you experience these symptoms, it's advisable to consult a healthcare provider to determine the cause and appropriate treatment. Empowering women through knowledge and self-awareness. The overarching theme of Dr. Morse's conversation is the empowerment that comes from understanding and embracing one's own body. By debunking myths, addressing insecurities, and promoting open communication, women can build the confidence needed to enjoy fulfilling sexual experiences. Knowledge is power, and learning about your own anatomy and preferences is the first step towards a more empowered and pleasurable sexual life. Exploring sexual techniques and enhancing pleasure. Enhancing sexual pleasure involves exploring different techniques, being open to experimentation, and maintaining clear communication with your partner. Dr. Emily Morse, a leading voice in sexual education, shares valuable insights into various methods and practices that can improve sexual experiences for both partners. From understanding the intricacies of female orgasm to practical tips for oral sex, this section delves into specific techniques that can elevate intimacy. Understanding female orgasm beyond penetration. A common misconception about female orgasm is that it primarily occurs through penetration. In reality, only about 20% of women consistently orgasm through penetrative sex alone. Dr. Morse emphasizes the importance of incorporating other forms of stimulation, such as clitoral touch, oral sex, and prolonged foreplay, to enhance the likelihood of orgasm. Clitoral stimulation. The clitoris is a highly sensitive organ with thousands of nerve endings, making it a primary source of pleasure for many women. Techniques such as light, rhythmic touches or gentle circular motions can be effective in stimulating the clitoris. Dr. Morse suggests experimenting with different pressures, speeds, and patterns to find what feels best for you. Incorporating sex toys. Introducing sex toys into the bedroom can be a great way to enhance pleasure and explore new sensations. Toys like vibrators, the womanizer, and Zumio are specifically designed to stimulate the clitoris and can be used alone or with a partner. Dr. Morse encourages couples to view sex toys as an enhancement rather than a replacement for their connection, allowing them to explore new dimensions of pleasure together. The Kevin method. One technique that Dr. Morse discusses is the Kevin method, which involves the partner approaching from the side, perpendicularly, rather than directly between the legs. This approach can help cover a wider area of nerve endings and may provide a different, more stimulating experience. Using lubricants or saliva can further enhance the sensation and reduce discomfort. The importance of lubrication. Lubrication plays a critical role in sexual pleasure, reducing friction and enhancing the overall experience. Dr. Morse strongly endorses the use of lube, not just for addressing dryness but as a means to make all forms of sexual activity more enjoyable and less likely to cause pain or discomfort. Benefits of using lube. Lubrication can help prevent vaginal tears and reduce the risk of infections like UTIs. It also allows for longer and more comfortable sessions of intimacy, which can be particularly beneficial for achieving multiple orgasms. Dr. Morse recommends keeping lube on hand as a regular part of your sexual routine, regardless of age or perceived need. Choosing the right lube. There are many types of lubricants available, including water-based, silicone-based, and oil-based options. Dr. Morse advises choosing a lube that suits your needs and is compatible with any sex toys you may be using. For example, silicone-based lubes are long-lasting and work well for anal sex, but they can degrade silicone toys, so it's important to match the lube with the activity and products you're using. Threesomes and relationship dynamics. Educational disclaimer. This script is for educational purposes only, intended to provide insights into the complexities of introducing a third person into a romantic relationship and the dynamics involved. The goal is to offer guidance on navigating these experiences in a respectful, safe, and consensual manner. The idea of threesomes often captures the imagination, fueled by media portrayals and societal curiosity. However, the reality of involving a third person in a sexual relationship is far more complex. Threesomes can either enhance or strain a relationship, depending on how they are approached. This section aims to explore the dynamics of threesomes, providing practical advice on communication, boundaries, and understanding one's motivations. Understanding motivations and intentions. Before diving into the practical aspects of threesomes, it's essential to understand why you and your partner might want to explore this experience. Are you looking to add excitement to your relationship, explore fantasies, or is it a way to address deeper issues within your partnership? It's crucial to recognize that threesomes should not be seen as a solution to relationship problems. Attempting to fix a struggling relationship by introducing a third person can often lead to more complications and emotional turmoil. Instead, threesomes are best suited for couples who are already secure, communicative, and in a healthy relationship. Mutual interest. Ensure that both partners are genuinely interested in the experience. It shouldn't be something one person is pressured into to please the other. Clear communication. Openly discuss your desires, concerns, and expectations with your partner. Honesty is key to ensuring that both parties are comfortable and on the same page. Emotional readiness. Assess your emotional readiness for a threesome. Are you prepared to see your partner with someone else? Are you comfortable with the potential emotional implications? Setting boundaries and guidelines. Once you've established that both partners are on board, the next critical step is to set clear boundaries and guidelines. These boundaries will serve as a roadmap to ensure that the experience is enjoyable and respectful for everyone involved. Establishing boundaries. Define what's off limits. Determine specific actions or scenarios that are not acceptable for either partner. This might include certain sexual acts, emotional interactions, or any behavior that crosses personal comfort zones. Choose the right third person. Deciding who to bring into your intimate space is a delicate decision. It's generally recommended to avoid involving close friends or acquaintances, as this can complicate the dynamic and lead to lingering emotions or awkwardness. Consent and comfort. Ensure that all parties involved are fully consenting and comfortable with the arrangement. Consent should be enthusiastic and ongoing, not just at the start but throughout the entire experience. Guidelines for a successful experience. Discuss safe words. Safe words are an excellent tool for maintaining control and comfort during the experience. If at any point someone feels uncomfortable, the safe word can signal a need to pause or stop. Respect everyone's feelings. Threesomes can bring out unexpected emotions, including jealousy or insecurity. It's important to regularly check in with each other and respect each other's feelings before, during, and after the encounter. Plan ahead. Planning ahead can help alleviate anxiety and ensure that everyone knows what to expect. This includes discussing the location, time, and any specific details that can help create a comfortable environment. Role-playing and communication as preparation. For couples interested in exploring threesomes but hesitant about diving in right away, role-playing and communication exercises can be a great way to test the waters. Fantasy exploration. Engage in role-playing scenarios that mimic the dynamics of a threesome without actually involving a third person. This can help both partners explore their comfort levels and identify any underlying concerns or desires. Use of toys and props. Incorporating sex toys or props can add to the experience of role-playing, making it feel more immersive and allowing partners to explore different dynamics safely. Communication exercises. Dirty talk and discussions. Talking openly about fantasies, including threesomes, can help desensitize the topic and make it less intimidating. It also provides an opportunity to express what specifically excites or worries each partner. Check-in conversations. Regular check-ins about your comfort level and thoughts on threesomes can help keep communication open and honest. This also reinforces that both partners' feelings are respected and valued. Common pitfalls and how to avoid them. Introducing a third person into your sexual relationship is not without its challenges. Understanding common pitfalls can help you navigate these experiences more smoothly. Pitfalls to watch out for. Using threesomes as a relationship fix. As previously mentioned, threesomes should not be used as a band-aid for relationship issues. Address any underlying problems in your relationship before considering adding a third person. Imbalanced interest. If one partner is significantly more interested in a threesome than the other, it can lead to resentment or feelings of pressure. Ensure that both partners are equally enthusiastic and comfortable with the idea. Emotional fallout. Even with the best planning, emotions can run high during and after a threesome. Be prepared for potential feelings of jealousy, insecurity, or discomfort, and have a plan in place for how to address these emotions. Strategies for success. Debrief after the experience. Take time after the threesome to talk about what went well and what could be improved. This can help process any emotions and reinforce the bond between you and your partner. Ongoing consent. Remember that consent is not a one-time deal. Check in regularly to ensure that everyone remains comfortable and willing participants throughout the experience. Respect boundaries. Even in the heat of the moment, it's crucial to respect the boundaries that were set beforehand. If something feels off or uncomfortable, don't be afraid to stop and reassess. When to reconsider or say no. It's perfectly okay to decide that a threesome is not right for you or your relationship. Not all fantasies need to be acted upon, and prioritizing your emotional and relational health is the most important factor. Signs it's not the right time. Persistent discomfort. If either partner feels persistently uncomfortable or pressured, it's a sign that the threesome may not be a good idea. Unresolved relationship issues. Address any significant relationship issues before considering a threesome. Introducing a third person into a tumultuous relationship can exacerbate existing problems. Lack of trust. A strong foundation of trust is essential for a threesome to be successful. If trust is lacking, it's best to work on rebuilding that trust before exploring threesomes. Threesomes can be an exciting way to explore new dimensions of your relationship, but they require careful consideration, communication, and respect for everyone involved. By setting clear boundaries, engaging in open dialogue, and prioritizing mutual comfort and consent, couples can navigate the complexities of threesomes in a healthy and positive way. Remember, the goal is to enhance your connection and enjoyment, not to fix or fill voids in the relationship. Always prioritize your emotional well-being and that of your partner above all else. This part has provided an in-depth look at the dynamics of threesomes and how to approach them with care and intention. In the next part, we will continue exploring other aspects of sexual experiences, including the role of mental health and sexual exploration. The impact of mental health on sexuality. Mental health plays a crucial role in how individuals experience and engage in sexual activity. Issues such as anxiety, depression, and stress can significantly affect sexual desire, performance, and satisfaction. Understanding these connections is key to addressing and overcoming related challenges. Common mental health issues affecting sexuality. Anxiety can manifest in various ways, including performance anxiety, worry about body image, or fear of intimacy. These feelings can inhibit sexual desire and enjoyment, creating a cycle of stress and dissatisfaction. Depression often leads to a decrease in libido and sexual interest. Feelings of hopelessness or low self-esteem can affect one's ability to engage in and enjoy sexual activity. Stress. High levels of stress can lead to physical symptoms such as fatigue and reduced sexual drive. Stress also affects hormonal balance, which can further impact sexual function and satisfaction. Addressing mental health concerns. Seek professional help. Consulting a mental health professional can provide valuable support and strategies for managing anxiety, depression, or stress. Therapy and counseling can help address underlying issues that affect sexual well-being. Practice self-care. Engaging in regular self-care practices, such as exercise, healthy eating, and mindfulness, can help manage stress and improve mental health. Prioritizing self-care can enhance overall well-being and sexual satisfaction. Communication. Openly discussing mental health challenges with a partner can foster understanding and support. This communication can alleviate some of the stress and anxiety associated with sexual experiences. The role of sexual exploration in mental health. Sexual exploration can be a positive force in mental health, contributing to self-discovery, confidence, and emotional well-being. Exploring one's sexuality can enhance self-esteem and provide a sense of empowerment and connection. Benefits of sexual exploration. Self-discovery. Exploring different aspects of sexuality, including fantasies, preferences, and new experiences, can lead to greater self-awareness and self-acceptance. Increased confidence. Gaining knowledge about one's body and sexual preferences can boost confidence and improve sexual satisfaction. Feeling comfortable and confident in one's sexuality can have a positive impact on mental health. Enhanced intimacy. Sexual exploration can deepen emotional connections with a partner, fostering intimacy and strengthening the relationship. Building a strong emotional bond can contribute to overall mental well-being. Ways to explore sexually. Educate yourself. Learning about sexual health, techniques, and preferences through books, workshops, or reputable online resources can enhance your sexual knowledge and confidence. Experiment safely. Engaging in new sexual experiences or trying out different techniques can be exciting and fulfilling. Ensure that any exploration is consensual and respectful of both partners' boundaries. Explore fantasies. Discussing and exploring sexual fantasies with a partner can be a way to enhance sexual satisfaction and emotional connection. Ensure that fantasies are explored in a safe and consensual manner. The intersection of mental health and sexual satisfaction. Mental health and sexual satisfaction are deeply intertwined, with each influencing the other. A satisfying sex life can contribute to improved mental health, while mental health challenges can impact sexual experiences. Understanding this connection is essential for addressing both areas effectively. Enhancing sexual satisfaction. Focus on pleasure. Prioritizing pleasure and enjoyment in sexual experiences can lead to greater satisfaction and a more positive outlook on sex. Shift the focus from performance to connection and enjoyment. Practice mindfulness. Mindfulness techniques, such as deep breathing and being present in the moment, can help reduce anxiety and enhance sexual experiences. Mindfulness can also improve emotional connection with a partner. Set realistic expectations. Setting realistic expectations for sexual experiences can help reduce performance anxiety and increase satisfaction. Embrace imperfections and focus on the overall experience rather than specific outcomes. Addressing sexual dissatisfaction. Identify underlying issues. If sexual dissatisfaction persists, consider exploring potential underlying mental health issues. Addressing these issues can lead to improvements in sexual experiences and overall well-being. Seek professional support. A therapist or counselor specializing in sexual health can provide guidance and support for addressing sexual dissatisfaction. Professional support can help identify and address contributing factors. Communicate openly. Open and honest communication with a partner about sexual needs, desires, and concerns can help improve sexual satisfaction and strengthen the relationship. Navigating mental health and sexual exploration together. Combining efforts to address mental health and explore sexuality can lead to a more holistic approach to well-being. Both areas are important for achieving a balanced and fulfilling life, and addressing them together can lead to positive outcomes. Holistic approach. Integrate strategies. Incorporate strategies for managing mental health, such as therapy and self-care, with efforts to explore and enhance sexual experiences. A holistic approach ensures that both areas are addressed in tandem. Foster supportive relationships. Build and maintain supportive relationships with partners, friends, and mental health professionals. Supportive relationships contribute to overall well-being and sexual satisfaction. Celebrate progress. Acknowledge and celebrate progress in both mental health and sexual exploration. Recognize achievements and improvements, no matter how small, as steps toward a more fulfilling life. Mental health and sexual exploration are deeply connected, with each influencing the other in significant ways. By understanding and addressing mental health concerns, exploring sexuality with confidence, and maintaining open communication, individuals can enhance both their mental well-being and sexual satisfaction. Prioritizing self-care, seeking professional support, and fostering supportive relationships contribute to a balanced and fulfilling life. Embrace the journey of self-discovery and exploration with an open mind and a focus on holistic well-being. This part concludes our exploration of the intersection between mental health and sexual exploration. By integrating these insights into your life, you can enhance both your mental and sexual well-being, leading to a more fulfilling and balanced existence. As we conclude this in-depth exploration of sexual health, confidence, and the intersection of mental health with sexual exploration, it is clear that a holistic approach to these topics is essential for achieving both personal satisfaction and overall well-being. Each section of our discussion has unveiled valuable insights into how confidence, knowledge, and mental health contribute to a more fulfilling sexual experience. Let's recap and reflect on the key takeaways. Building sexual confidence and overcoming insecurities. Confidence in the bedroom starts with understanding and accepting your own body. Embracing body positivity and self-love is fundamental to overcoming insecurities and enjoying a fulfilling sexual life. Educating yourself about your own anatomy, addressing myths and misconceptions about sexual preferences, and communicating openly with your partner are crucial steps toward enhancing sexual satisfaction. Self-acceptance, embracing your unique body and preferences is crucial for confidence. Education, learning about your anatomy and sexual preferences can empower you. Communication, open dialogue with your partner helps align sexual experiences with mutual satisfaction. Navigating relationship dynamics and sexual practices. Successful relationships and satisfying sexual experiences often require understanding and addressing various dynamics, including the introduction of new elements like threesomes. Ensuring that all parties are comfortable, communicating openly about desires and boundaries, and respecting each other's needs are key to maintaining a healthy and fulfilling sexual relationship. Additionally, exploring sexual practices, like the Kevin method and the use of lubrication, can enhance pleasure and reduce discomfort. Key takeaways. Boundaries and consent. Clear communication and mutual consent are essential for exploring new sexual experiences. Sexual techniques and tools, such as lubrication and the Kevin method, can enhance pleasure and comfort. Avoiding misconceptions, addressing myths perpetuated by pornography and focusing on realistic expectations can improve sexual satisfaction. The intersection of mental health and sexual exploration. Mental health profoundly impacts sexual experiences and satisfaction. Addressing mental health concerns, such as anxiety and depression, can lead to improved sexual well-being. Conversely, exploring and embracing one's sexuality can positively affect mental health by boosting confidence and self-awareness. A holistic approach that integrates mental health care with sexual exploration can lead to a more balanced and fulfilling life. Mental health impact. Understanding how mental health issues affect sexual experiences is crucial for addressing dissatisfaction. Sexual exploration. Exploring your sexuality can enhance self-confidence and emotional connection. Holistic approach. Combining mental health care with sexual exploration strategies contributes to overall well-being. We encourage you to take these insights and apply them to your own life. Embrace the journey of self-discovery, practice open communication with your partner, and prioritize both your mental and sexual well-being. If you find yourself struggling with sexual confidence or mental health issues, seek support from professionals and engage in educational resources to further your understanding. Educate yourself. Dive deeper into sexual health and mental well-being by accessing reputable resources and educational materials. Seek professional support. consider speaking with a therapist or counselor specializing in sexual health and mental wellness for personalized guidance. Communicate openly. Foster open dialogue with your partner to enhance your sexual experiences and address any concerns. By taking proactive steps and applying these principles, you can cultivate a more satisfying and balanced approach to your sexual and mental health. Embrace the journey with confidence, curiosity, and a commitment to ongoing growth and exploration. Thank you for joining us on this educational journey. For more insights and resources, stay tuned to our platform and continue exploring the paths to personal and sexual well-being.